Hi guys, so I'm in my car again. I just got this video idea that I thought I should talk about. For those of you who already know me, know that I am 9 months pregnant. I have been placed on maternity leave from my primary job, which is at the hospital. I work on a telemetry floor, which is kind of like an ICU step down. We get up to 5 patients and we're basically on our feet all day. So I am on a leave from that job, but I'm still doing a few visits here and there with my home health job, which is what I'm going to do right now. I just got this patient and I've never seen this patient before. I just got assigned to this patient, so I have to go and open up the case. I wouldn't say I'm still working, but sometimes they need an RN to do the admission, which is open up the case in order for the other nurse to take over. So that's what I'm going to be doing today. I'm supposed to meet up with the patient much later on, but I came super early because this is kind of far out from where I live. Secondly, I don't like to be in a rush anymore just because of my condition. So I'm just sitting here and waiting until it's time for me to go in and speak to the patient and also do what I'm supposed to do as far as my job goes. So I'm sorry about the lighting. I'm in my car if you can't already tell. And that is the baby's car seat back there. We already have it installed. Because your girl is going to be a mama, y'all. I'm going to be driving around with a car seat in my car. It's so funny how life changes in like 2 seconds. Anyways, so the topic I wanted to talk about today, I got this question from one of my viewers. I think she said she was 17 years old and she wanted to know what nursing is. So that is a pretty vague question, but that's also a legitimate question. Some people really don't know what nursing is. So I want to answer this question, but it's not going to be in the traditional way of how someone else may answer this question. And dealing with a lot of home health patients and just patients in general, that to me is a great question because I feel like I can actually answer this question. So first of all, what is a nurse? A nurse is not just one thing, and you don't know this until you become a nurse. So let's say you get a job somewhere. They are going to give you a responsibility, things you're supposed to do. But trust me, the list is so long. So I'm just going to tell you a few things that you're going to be responsible for. When you're a nurse, your job is to administer medications to patients. You would think that's the only thing you do as a nurse is to go to work and administer medication. But if you think that, you are sadly mistaken. And I had to learn this the hard way myself. When you're a nurse, you are a friend. You are a counselor. So if the patient is having some mommy issue, daddy issue, family issue, marital issues, you are that patient's listening ears. You kind of have to listen to them, listen to what they're saying, be an open and listening ear for them to be able to vent and for them to be able to express how they feel. You have to be empathetic, which just basically means that you have to be able to listen to them, hear them, understand them, and maybe offer some suggestion, not advice, but suggestion. So for example, if a patient tells you that they are in a bad relationship, it's not your job to tell them to leave their husband or their spouse or whoever, but it is your job to try to help lead them in the right direction. So going in that line, you are also kind of like a detective and a crime reporter. So using that same example, if the patient tells you that they are in a bad relationship and their husband is abusive or their wife is abusive, you have to be able to report that to the appropriate parties. Also, if a patient comes in, let's say it's a pediatric patient or a minor, and you see a lot of cuts and bruises on this patient's skin, or the patient looks like they are malnourished, or the patient just looks like they are in an abusive situation or not a healthy situation, you have to be able to detect that in the smart way, and you have to be able to report it as well. So you can't say, oh, it's none of my business. I'm just here to administer medication. That's your family problem, so you go ahead and deal with it. You have to do something about it because you are obligated as a healthcare professional to report that. You are also kind of like a protector because your job is to do no harm. You have to protect that patient in any and every way. Let's say you have a confused patient or a patient with dementia or a patient with some psychotic issues. You have to keep that patient protected. So if that patient has restraints on, you have to make sure that there is still blood circulating throughout this patient's body, especially at those sites of restraints. You have to make sure that they still have feelings. So you have to do checks. You have to check those patients frequently, and you also have to make sure they are getting their nutrition. You also have to make sure that they are breathing well, they are well circulated. You have to make sure of all those things. As a nurse, you are also a communicator and a mediator. So you communicate with every single person. You communicate with the patient's family, the doctors, co-workers, social worker, case manager, fellow nurses, charge nurse, supervisor. You communicate with everybody, and you have to be kind of like a negotiator where, let's say the patient is on Tylenol and they said that their pain is not being relieved by this Tylenol. You have to be able to assess that situation, call the doctor and ask for something stronger, and you have to tell the doctor why you're asking for something stronger. And if the doctor says no, you have to go back and tell the patient in a nice, smart way that the doctor basically said no without saying those exact words. Or if you feel like the doctor is undertreating the person, you have to also be able to plead your case to the doctor and tell them, well, this is what the patient is going through. This is what I've seen throughout my shift. And I feel like the patient needs this and this and this in order to get the best care for that patient, because the doctor only sees the patient for 15 minutes at most. You're with the patients for 12 hours. You have to hear about their pain and their discomfort and everything they're going through. So you have to be able to adequately advocate for that patient. You have to be a resource person for this patient as well. Nurses are teachers in the sense that if you're giving a patient a medication that they have never heard about, you have to be smart enough to educate yourself about this medication. Your job is not to know every single medication, every side effect, every contraindication, but the medications you are dealing with and the patients you are dealing with, it is your job to educate yourself beforehand so that if the patient has questions, you can be able to answer those questions. Even if the patients have questions that you don't have answers to, you have to be able to tell them, that is a great question, and I understand your concerns, but let me do a little more research and get back to you. You sound smarter that way than telling the patient, I don't know. So you're not going to know everything as a nurse. Even doctors don't know everything. Even though I feel like a lot of doctors think that they are God, but there is a reason doctor is not spelled G-O-D. We're all learning on a daily basis. So as a nurse, if a patient asks you a question and you don't know the answer, just simply tell them, let me get back to you with that, and make sure you do get back to them. As a nurse, you are also a trustworthy person. If you tell a patient you're going to do something, you have to do what you said you were going to do. Otherwise, patients will lose trust in you like that. So even if it's something as simple as, I'll be back with a cup of water for you, you have to come back with a cup of water. The best way to do this is write everything down. Always have a clipboard with a piece of paper on it and a pen handy. So if the patient asks you about a cup of water or ice, write it down. When you accomplish that, cross it out, because you will forget. Just because you have a million things going on and you're not able to remember everything, but then you also have to keep your promises with those patients. As a nurse, you're also going to be changing patients, as far as like changing their diapers or changing their soiled linens, or, tidying up their rooms a little bit. That is your job. If you're in there and the patient's pillow falls to the floor and they're like, hey, can you pick that up for me? You're not going to say, oh, that is not my job. Let me get the PCA to do that. No, you're going to pick it up, go grab a clean pillowcase, change it up, and give it to the patient. So you're a server in that sense. If the patient's lunch is here and the PCA is nowhere to be found, it is your job to take the patient's food and go and hand it to them. And if they say, oh, there's a fork missing, or my apple juice is missing, my this and that is missing, you have to go and get it. So what I'm basically trying to say here in a nutshell is, as a nurse, your job is not one specific thing. Your job is everything and anything that comes up during your shift. You are a crisis manager. You are a servant. You are a server. You are a friend, a companion, a trusted medical professional. You are just everything in one. So I guess whoever invented nursing couldn't come up with a term for all of these things, so they just gave it the blanket term nursing. So I hope that answered that question. If you guys had any doubt about being a nurse or any questions about being a nurse, it's just something that you have to play as you go. First, you get your license that qualifies you to administer medication, and then everything else comes with it. So I hope that answered you guys guys this question. I feel like I've been sitting here talking for a while and it's almost time to go in. So I'm going to go ahead and open this case and, do everything I need to do and go home and rest. I don't know how many more of these visits I'm going to be able to do anymore, but I'm doing as much as I can. As I said, I'm not able to do shift work anymore because I have weightlifting restrictions and I have a lot more restrictions that I can't do as a floor nurse. So I'm going to be chilling at home for a few months, but I'm still going to be doing my home health visits and doing other nursing work from home. And as you guys know as well, I'm in school, so I'll be doing my school work. So there will be no dull moments. I don't even like being bored. So I'll have a baby to take care of soon. So I will find a way to keep myself busy. Okay, so that is it for this video, guys. I hope you guys enjoyed it. I'm going to start driving towards my patient's house and go do what I gotta do, y'all. So I will see you guys in my next one. If you have any questions for me at all, please go ahead and leave them in the comment section below. If you guys want me to do one of those day in the life of a nurse video, like day in the life of a home health nurse, day in the life of a hospital nurse, anything like that, go ahead and let me know. I will make those videos and go ahead and post them. So that is it for this video, guys. I gotta go. I'll see you guys later.